Sago, Scano, hello everyone. This is Lori Davis Hill, Incident Command for the Pandemic Response on Six Nations and the Director of Health Services. This is your COVID-19 podcast for October 27th, 2020. At this time, Six Nations remains in outbreak due to the significant number of active cases. With that in mind, let's turn our attention to the wellness area for some support and guidance regarding exposure to the COVID-19 virus. I would like to spend some time with a guest today who is going to share information with us about coping with COVID-19. Please welcome Daniel King. Scano Daniel, can you tell us about your role and what you're going to share with us today?
Hello, everyone. My name is Daniel King, and I am on the Gandel Community Crisis Response Team. Today, I will be speaking about coping with an exposure to a COVID-19 case. Finding out you may have been exposed to someone with COVID-19, getting tested, and waiting for COVID-19 results can create a lot of fear, anxiety, and stress. I will let you know that fear and anxiety are all normal reactions to uncertain situations. Fear and anxiety are normal biological responses. It is when the fear and anxiety become overwhelming that you should seek out support by a professional. I want to provide you with some tips and strategies for coping with an exposure to a COVID-19 case. Coping with fear of exposure to COVID-19. First off, I'd like to say that no one is immune from being exposed to COVID-19. With the recent uptick in cases in our community, it is more important now than ever to ensure that you are following proper COVID-19 prevention protocols, such as hand washing, mask wearing, and physical distancing. The best way to start managing fear is to fully process what exactly you're afraid of and why. If you're afraid of getting sick yourself, it's important to recognize that there may be underlying reasons why. There are a number of questions that you should ask yourself, such as, is it because of the uncertainty of how the disease would impact me? Is it more related to having to take time off work and feeling guilty about it? A lot of concerns right now are extremely valid. Once you dig deeper into why you're afraid, you can start to plan for it if the situation occurs. Planning is a way you can regain and take control to ease fears and anxieties. An example of planning would be contacting family, friends, or neighbors who can assist you if you are placed in a situation where you must self-isolate. Having a plan can help alleviate anxiety by flipping your thought process from what if to this might happen and it will be okay. If your fear is rooted in being a carrier of COVID-19 and getting your family sick, it is vital to remember the precautions and guidance that have been put in place to prevent that. How are you keeping yourself safe while at work? What precautions have been put in place, and are you following them? Are you staying home when possible and wearing a mask out in public? Most likely, you're doing everything you can to keep everyone safe. There could be other actions that you can take to reduce your stress around this subject, like having a good sanitation routine for when you first get home from work, especially before interacting with people you live with. With most stresses and anxieties in life, the best way to handle uncertainty is to focus on what you do have control over. Try your best to make sure you feel control over other parts of your life. These could include keeping your bedroom or bathroom clean, and meal planning can help you feel significantly less overwhelmed. It is normal to feel afraid right now, but it's extremely important to pay attention to your situation and how you're feeling. If you would like more information on this topic or any other topic related to mental health, please reach out to the Six Nations Mental Health and Addiction Services at 519-445-2143. Their office hours are Monday to Friday, 8:30 to 4:30. They're located at 1769 Chiefswood Road in Ohsweken. Walk-in crisis services are available during business hours. Also, you can reach out to the Six Nations Mobile Crisis Line 24/7. Text and live chat is now available during business hours. Their contact number is 519-445-2204, or they can be reached at 1-866-445-2204. If you would like More information on COVID-19, please reach out to Public Health and or the Six Nations COVID-19 Information Assessment Center at 1-855-977-7737 or 226-446-9909.
What time?
Thank you again for having me on the podcast today. Stay well, everyone.
Daniel, for joining us today. We certainly appreciate all of the information you shared, and we hope our community members will reach out for support. Now let's turn our attention to the numbers. Over the past month, the number of cases have been rising significantly. That's right, over the course of the last 7 days, the province have recorded daily new cases at an average of 878, with numbers reaching over 1,000 in the past 3 days. To update the current state in Ontario, there are 71,224 total cases. Of those, 60,839 are resolved, and 3,099 have resulted in death. With 851 new cases reported yesterday, this means there are currently 7,296 active cases of COVID-19 in Ontario. 295 of those are in hospital, 78 are in intensive care, and 51 of those are on ventilators. Here at Six Nations, we have had a total of 88 lab-confirmed positive cases with 1 death. As of October 26th, we have 23 active cases with 7 new cases reported yesterday on October 26th. Having a look at our testing numbers, 2,904 tests have been completed. Of those tests, 2,543 are showing negative results so far. Ohsweken Public Health and the Assessment Center have directed 287 people into self-isolation as present. Now over to our adjacent communities, and as of 9 a.m. this morning, Mississaugas of the Credit reported no active cases. They have had a total of 2 positive cases since COVID began. Haldeman Norfolk Public Health Unit reports 526 total positive cases, 26 cases are active, 463 cases are recovered, and they have had 32 COVID-related deaths. The Brant Public Health Unit reports 238 total positive cases, 24 are active, 209 have resolved, and there have been 5 COVID-related deaths. Hamilton Public Health Unit reports 1,698 total cases, 162 are active, 1,485 have resolved, and there have been 48 COVID-related deaths. And Toronto Public Health Unit reports 26,586 total cases, 2,950 are active, 22,286 have resolved, and there have been 1,350 deaths. With these numbers in our community and in surrounding areas, Project Protect Our People requires all of us to do our part. I would now like to introduce Lacey VanEvery, Acting Nurse in Charge at Ohsweken Public Health and the GEDEO Health Center. Scano, Lacey.
Scano, thanks for having me here.
Would you share with us how the recent spike in cases has impacted your team and all of the activities that are required to happen when a positive test result is received?
Oh, that's a big question. Let me give some context to where we are at here. This recent spike has been quite the whirlwind so far. It started with all the planning we have put into educating community members on COVID-19 way back in March. Our nurses went to all the schools prior to March break with the community educators, and we really highlighted hand washing, covering coughs, and staying home when you are sick. We approached the schools because we were well aware of people's plans to travel over March break. And we really hoped with the uncertainty of the times, people would reconsider. That was the last the students were in the schools. Over the summer, we continued to keep an eye on anyone who was getting tested and ensured they complied with the isolation recommendations. We also had some nurses working with the IMT planning committee to help inform the educational pieces for the community. We had some cases early on and they were managed very well. Our goal has been to contain the spread of this virus to the best of our abilities. With the help of all the services we have in the community and the dedicated community members, we see the value in not spreading the virus any further than what it had. It really reduced our numbers to 0 active cases for the majority of the summer. And then we came into fall and the mandate, the plan for influenza season changed how we were planning some of our programming. So we began planning later than usual for the influenza season because of the ongoing uncertainty of the pandemic. But with a push to start returning to a normal, we had no choice to evaluate our current COVID-19 response and seek help with managing those who were getting tested. Our assessment center really stepped up, and they've taken an active role in providing the community support to those in self-isolation. So this freed up our department to look at what had been put on a back burner for months, such as our immunization program, our Well Baby program, and helping schools to prepare for a return of students. So we've been very busy with this pandemic. It's been nonstop COVID for our team since March, as you are well aware of. We try to ensure the community receive the appropriate health teaching to keep themselves safe during these times. However, with the decrease in cases in our community, it was challenging for some of the information to hold merit. Our community was moving forward with plans to return to some sort of normalcy. I also encouraged my team to take some time off to recuperate from the spring season, as we did not know what the fall time held, given it's our normal cold and flu season. Nothing has changed in terms of what COVID-19 is. It is still a virus declared as a global pandemic and a reportable disease to local public health units. Therefore, we are to continue following the required reporting of all cases of COVID-19. With the recent surge, it's put Ohsweken Public Health back into a position of focusing only on COVID-19 case management and contact tracing. It's a big job. Our nurses have been nonstop for the past few weeks. It's hard to take a break from this work too, with more cases that keep coming in. So we have called on federal and provincial resources to help manage the increase in cases. All contact tracing is done with telephone call check-ins. I know it's difficult for those who do not understand contact tracing. However, it is a helpful tool to assist with identifying where this virus may have spread and allow us to work at ensuring we are still following our goal of containing the virus to the best of our ability. It's challenging trying to get information from people and explain how vital their information can be. We have put out communications on the usefulness of contact tracing. One of the biggest barriers we have faced with contact tracing is the willingness of individuals to be honest and forthright with where they've been and who they've been in contact with. If we miss someone in our contact tracing, it can have further detrimental effects on the entire community. It only takes one person to infect many, depending on their social activities. If we miss someone, that one infected person can carry on the trend of increased cases. Some nurses have expressed frustration with people not listening to our messaging. As you may now realize, our nurses are exhausted. We are human beings as well, and since we have been in battle through this pandemic, we have spent countless hours away from our families. All of us have children, and it makes it especially challenging dealing with the stress on a family for absence, as well as the demands of keeping our community safe. We encourage others to stay home as much as possible. Many people don't realize we, your health team, do not have that option right now. We have to respond.
We can certainly hear the exhaustion from yourself and from others that we speak to on a regular basis. I want to send our huge nawagoa to you and your team. What messages would you like to send to the community to help us continue to protect our people?
Stay home and stick to your household. Don't go out unless you absolutely have to. I know everyone is tired of hearing about COVID, but it is still here. I can't speak to those who have been through the illness, but I know what it's like to respond to the call of duty during these times, and it is tough. We hear everyone's frustrations with the messaging, and we try to redirect to show the positives that this is the way it is, to try and keep everyone safe. Nobody could have predicted this happening the way that it has. We can still keep the virus contained from further spread if we all take the necessary precautions and utilize common sense. So the next time you're invited to a shindig, ask yourself, is it worth it right now? What if someone shows up and has COVID and they don't know it yet, and they could be spreading it to others? Think of those who continue to work through this pandemic. All of the emergency responders, the health staff, the team leads who have not had a break from pandemic work yet. I know the community members are tired of this. We are tired too, but this virus is still an organism looking for a place to live. It's not tired yet. It's just getting started. If we give it the fuel it needs to keep reproducing, we're going to be in this a lot longer than people realize. Instead of complaining, think of the positives in your situation. It's so easy to focus on the negative and always a challenge to pull out the positive. So I'll leave one note on positivity. Throughout this pandemic, I have seen so much outpouring of support to our community members, and it warms my heart just to see how so many people actually care for others, even if they're struggling themselves. That's what we need more of, a collective consideration of all of our people. I- If you would like to reach out to Michigan Public Health, you can call us Monday to Friday, 8:30 to 4:30 at 519-445-2672. And for after-hour support, you can reach out to our on-call environmental public health officer at 1-855-407-2676.
For joining us, Lacey, and sharing all of your good words and letting us know, what it's like on the front lines. We know that everyone's getting weary, and so we appreciate all of the efforts of your team members, of our team members, and especially for the members of the community who are doing their part to protect our people. Also, remembering to protect our people upon your entrance to Six Nations, even if you're visiting just for a day, face masks must be worn in all public buildings, and there's a mandatory 14-day self-isolation for anyone crossing the United States border. Also, please note that Six Nations is requesting that all gatherings be limited to those within your household with public health measures in place. Physical distancing, wearing masks, and hand washing. These limits will help us help each other to continue to protect our people. I also want to remind you that the COVID-19 hotline remains open. Testing here at Six Nations is available to any Six Nations community members with an appointment on Monday, Wednesday, and Friday mornings. Our team is monitoring the calls daily and are able to expand those hours when needed. The Six Nations COVID-19 Assessment Center can be reached at 226-446-9909 or toll free through at 1-855-977-7737. As you have heard in prior podcasts about the importance of contact tracing, and as Lacey shared today, we are announcing the new contact tracing app that is available. It's completely voluntary and collects no personal information. If you're interested, please visit the following website to find out more. It's at https :// COVID-19 COVID19.ontario.ca /COVID alert. Before I close today, a reminder to watch Healthy Six Nay and Six Nations Matters on Facebook for ongoing updates to programming being provided. You can also refer to our fall leisure guide for more information. Please look for our flyer regarding the drive-through Halloween event on Friday, October 30th, being held at the Gathering Place. Public Health again would like to remind everyone they are ready to provide you and your child with immunization, and are starting the fall flu clinics as well. Please call 519-445-2672 to schedule an appointment or for more information. And a reminder, if you would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone at 866-445-2204 or 519-445-2204, and that's available 24/7. You can reach them by text Monday to Friday, 8:30 to 4 at 226-777-9480, or by live chat Monday to Friday, 8:30 to 4, and that's found on the Six Nations Covid19.ca website. You can also find much more information about Six Nations' fight with COVID-19 on that website. Please remember frontline workers here on Six Nations and around the world. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Noah.